Well, thank you very much, Governor McMaster. Thank you for not only your hospitality today and the hospitality of the University of South Carolina School of Medicine, but also, Governor, I just want to take a moment on the President's behalf, on the Secretary's behalf, and on behalf of everyone on the White House Coronavirus Task Force, to say thank you to you, to your wonderful wife, Peggy, to Lieutenant Governor Yvette, and every member of your administration here in the state of South Carolina for the leadership that you have provided for the people of this state. I've worked with every governor in every state and every territory of America, but I can tell the people here of South Carolina that all along the way, Governor Henry McMaster has put the health of the people of South Carolina first. He's recognized the practical needs of families and businesses across this state. And I'd just like to invite everyone to join me in thanking Governor Henry McMaster for all of your efforts throughout the midst of this pandemic. And I am grateful to be here as well with two leaders who have just done yeoman's work throughout this pandemic as well. They are both members of the House of Representatives, one of whom I had the privilege of serving with during my years in the Congress, and another who simply has been a tremendous champion for the people of South Carolina. It is remarkable to think as we approach what we believe will be the beginning of what will ultimately end the coronavirus pandemic in America with an imminent vaccine likely to be approved within days, that it's been our partners in the Congress, Governor, as you know, that were there to recognize that we needed to make sure our healthcare workers had the supplies and the resources that they needed, that we scaled testing across the country, that we developed the therapeutics as well as the vaccines. But I just wanted to take a moment to say thanks to Congressman Jeff Duncan and Congressman William Timmons for also providing the support for South Carolina's families who've endured great challenges in this time. The direct payments to families, the direct support for businesses has made it possible for the communities here in South Carolina, and the families and businesses here to be able to endure this challenging time in the life of our nation with as little hardship as is possible. So join me in thanking these two great congressmen for their strong leadership throughout this pandemic. William and Jeff, we are really grateful to you. And as I said, it's so good for me and Secretary Alex Azar, who you'll hear from in a moment, to be here in South Carolina. It is amazing to think from the first time that we spoke about the coronavirus pandemic in this country. 10 months have passed, and at the President's direction and with your leadership here in South Carolina, we stood up the greatest national mobilization since World War II. 200 million tests have been performed. When I was tapped to lead the White House Coronavirus Task Force, we only had the capacity to perform some 10,000 coronavirus tests across this country, but I'm proud to report, as evidence of American innovation and the leadership that I described, we now do nearly 10 million coronavirus tests a day, giving us visibility on those that are susceptible to this pandemic and leaning into ensuring that those who are in harm's way are protected. We also stood up, as you know, Governor, working with you, we stood up an effort to make sure that personal protective equipment and supplies were available to our healthcare workers. And I want the people of South Carolina to know that while we gather here today to talk about Operation Warp Speed and what we believe will be the imminent approval of the first coronavirus vaccine for the American people in a matter of days, we recognize that we're going through a challenging time as we see cases rising in virtually every state in the country. But I want the people of this state to know that America has never been better prepared to combat the coronavirus than we are today. And we're going to continue to work around the clock to make sure that we have the testing, that our healthcare workers have the supplies, that we're distributing the therapeutics and the medicines to give relief to those that are struggling with this pandemic, even while we hasten the day that we make a safe and effective coronavirus vaccine available for the American people. As the Secretary will no doubt describe in just a few moments, we believe the FDA is doing their work very much in the public eye, and we anticipate in a matter of days the approval of the first coronavirus vaccine. It's amazing to think, though, Governor, as you know, about the speed with which Operation Warp Speed has moved. I was just speaking to one of the leaders here at the University of South Carolina School of Medicine, who I think described the pace of the development of this vaccine as mind-boggling. And the truth is, it is historic. It is nothing short of a medical miracle. The truth is, developing and manufacturing a vaccine can take up to 8 to 12 years. And we are literally on track because of extraordinary leadership at every level, because of the support of these members of Congress, and because of American scientific innovation. We're literally on track to have a safe and effective vaccine available for the American people between 8 and 12 months. That is unheard of, but it's a testament to this president's impatience as a leader, his willingness to say to everyone, we're going to do things safely, but we're going to do them differently. It's important for people to understand that we've cut no corners in the development of these vaccines. We have cut red tape, and we've done things on a dual track for the first time, Mr. Secretary, in the history of vaccine development in this country. Literally, at the President's direction, we literally purchased vaccines from companies before they were approved, so that in the event that they became approved, we would have millions of doses. And we anticipate before the end of this month to actually have doses for more than 20 million Americans as a result. In fact, as you'll hear in some detail in a moment, we anticipate, because of the structure of Operation Warp Speed, Governor, that if there is an approval within the next several days, that we will be working with extraordinary private sector partners like FedEx and UPS and McKesson. We will be shipping vaccine within 24 hours and working with some great retail partners like CVS and Walgreens. We'll actually be administering those vaccines within 24 hours of that. And I want to commend your health department, and I want to commend all the partners here in the health community across South Carolina for making that possible. So my message, while I'm going to turn it over to our congressman before the Secretary gives an update on Operation Warp Speed and we hear from your team, my message to the people of South Carolina is we're living in a challenging time. You see cases rising, but you need to be assured we've never been more prepared to combat this virus than we are today. And people deserve to know that we are just a few short days away from what I believe will be the beginning of the end of the coronavirus pandemic in America. Literally within a few short days, we believe we will obtain the approval to begin to distribute and administer millions of doses of the vaccine, according to the plan here in South Carolina that your administration has approved, Governor, among those that are most vulnerable and those that are serving in our hospitals and clinics across this great state. So my last word of admonition I'll save to the end. All of us still have a role to play, to do our part to protect the health of our family, our community, our neighbors, and our friends, the people of this state and this nation. But for now, we're here to focus on your plan for distribution. We look forward to hearing more details about the decisions that you've made, Governor McMaster, here in South Carolina. And again, I just want to end where I began in this conversation and say thank you, Governor Henry McMaster, and your entire team here in South Carolina for the extraordinary work that you've done putting the health of the people of South Carolina first. It has brought us to this day, and I believe will hasten the day that we put the coronavirus in the past. So I thank you from the bottom of my heart for that. With that, let me recognize Congressman William Timmons and then Congressman Jeff Duncan for their remarks. And thank you again for being here, Congressman.
Thank you, Vice President. I can't thank you enough for your leadership and the President's leadership. Operation Warp Speed has been a huge success. It is going to allow our country to get on the other side of this pandemic, and it is going to be a legacy that we will all be proud of for the Trump administration. Governor, I can't thank you enough for your leadership as well. Not only have you done everything necessary to protect the lives of the citizens of South Carolina, you've balanced it by making sure that as many businesses can survive this pandemic as possible. And that balance has not been found in many states. So I appreciate your leadership and the Lieutenant Governor's leadership, and we just all are very fortunate living in South Carolina, and we're ready to get back to work. So with that, Congressman Duncan, I'll let you take it from there.
Thank you, William. Vice President, thank you for coming back to South Carolina, and thank you for all that the Trump administration has done to help the folks in South Carolina and those across the nation as we took this virus head on. And Operation Warp Speed has been truly a successful approach. It shows what Americans can do when we put our mind to it.
That's right.
And I want to take the opportunity to thank all the frontline healthcare workers, not only at Prisma and University of South Carolina School of Medicine, but all over South Carolina. They are working long hours, working hard hours, and I want them to know that they are in our thoughts and prayers daily, because they are truly on the front line in this battle against COVID-19. So thank you, and Secretary Azar, you've done a tremendous job. As a member of the Energy and Commerce Committee, we have had numerous phone calls and Zoom calls with Secretary Azar to find out how things were going across the nation as we approach this pandemic. And your office has been tremendous in keeping us updated as policymakers in Congress. So I want to say thank you for that. Again, thank you, Mr. Vice President. Governor, Lieutenant Governor, thanks for all that you guys have done for South Carolina as well. Your leadership is to be commended. And with that, I'll yield back. Thanks.
Great job. Alex?
Well, thank you very much, Mr. Vice President, for pulling this roundtable together, and thank you, Dean Jenkins, for welcoming us. Thank you, Dr. Ostman, who we'll look forward to talking to in a bit, for welcoming us to your campus. And thanks, of course, to Representatives Duncan, Congressman Duncan, I've gotten to work with on the Energy and Commerce Committee, a great leader, supportive of everything we've done at HHS. Congressman Timmons, another fantastic leader from South Carolina. Thanks for being here and joining us. And I just want to, as the Vice President did, express a special appreciation to Governor McMaster. I get to be with the Vice President every week on the video calls that we do with all of the nation's governors, and I can tell you the people of South Carolina have in Governor McMaster just one of the great leaders in our country, fully engaged, always contributing, and very much a partner in every element of this response. You and your team in South Carolina have done just a fantastic job, and we really appreciate your partnership, especially working to protect vulnerable South Carolinians who are in long-term care facilities, while also taking into account their mental health needs and the role that their families play in supporting them. You've been balanced in everything that you've done. It's incredibly important that we get that balance right, that we're protecting people who are high at risk, but thinking also about the holistic vision of caring for patients and families, and you have done that. We're here in South Carolina because partnerships between the federal government and state governments are vital to getting safe and effective vaccines to every American who wants one. And as the Vice President said, the time is now. The FDA Advisory Committee is meeting as we speak on the Pfizer vaccine in a public hearing. And if all remains on track, we could see FDA authorization of the first vaccine in the United States within days. And as the Vice President mentioned, product would ship within 24 hours. But here's the important thing. 20 million Americans could be vaccinated just before the end of this month in December. A total of 50 million Americans could be vaccinated by the end of January. And thanks to President Trump's and Vice President Pence's leadership and Operation Warp Speed and the historic mobilization that has happened there, we expect to see 100 million vaccinations total by the end of February. The foundation of this were the three key partnerships of Operation Warp Speed, and you've seen two of them so far. One is the partnership across the federal government between HHS and the Department of Defense under the President and Vice President's leadership. The second is the partnership with the private sector, the government working with and mobilizing these great biopharmaceutical companies here in the United States. But the one that now is really going to be so critical is that third partnership, the partnership between the federal government and the states on distributing vaccine. I knew from the start that states needed to play a key role in the distribution and allocation of vaccines because we went through exactly this kind of planning for pandemic flu vaccination in the 2000s under President Bush when we implemented our state-based pandemic flu plans. We built strong partnerships with the states as part of that. So what is the role of states and why is it so important? The distribution of the physical vaccines from the factory to the front lines will generally be done by the healthcare distributor McKesson, which works with FedEx and other partners who do the actual shipping. In the case of the Pfizer vaccine, Pfizer will ship directly through FedEx, and we will use McKesson to marry their product up with the vaccine administration kits that Operation Warp Speed has procured and assembled. Over 100 million assembled already. States are in charge of telling us where the vaccines should be shipped. They've been working on their allocation plans with CDC and OWS for several months now. And they can draw on the recommendations of CDC's Advisory Committee on Immunization Practices, the advice of the National Academies of Sciences, and their own best judgment to develop the best allocation plan for their own citizens' situations. States have different circumstances and are in different epidemiological situations, so state leaders are in the best position to take these general national recommendations and translate them into more precise guidance that fits their state and their conditions. In general, states will also be giving us information about providers to whom we will ship vaccines, pharmacy partners, hospitals, community health centers, and the like. We've paid for the vaccines. We've paid for the shipping costs. The administration costs for these will be borne by private sector partners like healthcare payers, private insurance, Medicare, Medicaid, as well as our program to cover COVID-19 expenses for the uninsured. We've reached agreements with pharmacy chains and independent pharmacy networks so that states can have products shipped directly to them, where those private partners will handle administration. That includes, for instance, an agreement with CVS and Walgreens to administer vaccinations at long-term care facilities like nursing homes and assisted living centers, an overwhelming share of which have signed up. Finally, Operation Warp Speed has also been working to expand our arsenal of therapeutics, and I want to remind everyone that all Americans who have recovered from COVID-19 can play a role in this by donating convalescent plasma, a promising treatment for the disease. If you are within 3 months of recovering from COVID-19, and that includes millions and millions of Americans, you have a chance to donate plasma and you can help save a life. Please contact the American Red Cross, your local blood bank, or visit coronavirus.gov to learn more about how you can volunteer and give the gift of life. With that, I want to hand things over to our great Governor McMaster, who will lead us in a discussion about South Carolina's distribution plans. Governor McMaster?
Thank you, Mr. Secretary. And again,
I'll jump in very quickly there.
Yes, sir.
With your permission, Governor McMaster, I wanted to thank Secretary Azar for that great description, but I also wanted to give all the great South Carolinians gathered here a word of appreciation. I hailed from Indiana when I took this job as Vice President, and we looked to Indiana to find someone I'd known for many years to lead Health and Human Services after a few short years. And I must tell you, having worked, Governor, shoulder to shoulder with Secretary Alex Azar throughout this pandemic, that America's been so well served by your leadership, your dedication, the countless hours. And I just want to invite everyone here to join me in thanking Secretary Alex Azar for a job well done. Well, Governor, as the Secretary described, and I think it's important for people of South Carolina to know that while we mobilized research companies early on, while the federal government, with the support of these congressmen, was able to actually fund the manufacture of vaccines, and through the advisory process, the CDC has made recommendations about to whom these vaccines go. We followed all along an approach to this pandemic that is federally supported but state managed. And so, Governor, you know that while we made recommendations about not how but to whom the vaccines would be distributed, ultimately that is a decision that fell to your office, to your health officials, and to the people of South Carolina. We simply believe that state leadership, local health officials know best about the point of the need, and so would welcome an update from you. The Secretary and I both would on the recommendations. We've reviewed your plan. South Carolina has a great plan for getting vaccines distributed to South Carolinians most in need, and that would be most beneficial to supporting the healthcare system across this state. But I'd love to hear some detail from you about decisions that you've made and any ways that we can leave from here and continue to be helpful as you implement a distribution plan for those vaccines that we believe will be available very soon. Governor?
Thank you, Mr. Vice President. I'd like to echo those words and others. You and Secretary Azar have been on the telephone. Have always been 100% available without ceremony and formality. And I think we've discussed, you've heard before, we've had video conferences at least 45 or 50 times, and there have also been some that had the president participating as well. But I have never seen, and no one that I know has ever seen, such massive participation, collaboration, communication, and cooperation among the federal government, the state governments, and everyone involved. And it is quite a tribute to the understanding of the needs of the nation, what this administration has put together.
Thank you, guys.
So we in South Carolina, on behalf of 5 million plus proud, happy South Carolinians, we do want to thank you for an extraordinary effort. Has been mentioned, to getting the vaccine produced in a record, extraordinary time that no one could have imagined. And not only that, that is an enormous accomplishment, and great thanks go to President Trump for his enormous leadership. But also the decision to have while the development was going on, to have the production to be going on at the same time. So when we got the vaccine approved, it'd be ready to go instead of having to wait again. A lot of new, innovative thinking went into this, and we deeply appreciate it. There are a lot of people in South Carolina alive right now because of the leadership that you've given us. And I want to thank those that are here. I want to thank PRISMA, the University of South Carolina, Dean Jenkins, and all involved. But I especially, and the Congressman, we appreciate so much the work you did on the CARES Act to get that done, working with the President and Vice President, because it has made an enormous difference. But I also want to thank the people of South Carolina who've accepted these limitations and hardships with dignity and grace and cooperation and understanding, and have done so without complaint and certainly without rejection. And it's always a pleasure to work with the people and for the people of South Carolina. And there's one hint that this is not something new. One of our great 4-star generals once said that there's more patriotism per square inch in South Carolina than any other place in the world. And I tend to agree with that, and I think that is reflected in the kind of spirit that we have seen in this very trying episode. Mr. Vice President, the details, I will try to be brief, although they are details, and I will recite them. Some of you have heard them before, but I think they bear repeating. We know we have determined that there are many ways to fight this virus, but the best way, the better way, is to have fewer restrictions and more advice. And that is what we have done. We know that we're wearing a mask, social distancing, washing your hands routinely, and now we know that staying outside as much as possible and being in the fresh air instead of being locked up, as some people were when they visited the beaches back on Memorial Day. We thought, well, everybody will be outside, so the numbers will go down because there'll be plenty of fresh air. Well, it turned out they did go outside, but then it's so hot they went inside, and they were in the houses, and that's what we believe that resulted in the spike then. We hope that will not happen now that weather is getting cooler here. We understand the lesson we learned then, so we encourage everyone to stay outside, breathe fresh air as much as you can, keep your car windows open, those sorts of things as much as possible, and follow the rules and be smart. This is the distribution of this miraculous vaccine is going to be a slow process, and we have urged the people of South Carolina to understand that it will be slow. There will be not enough to go around at the beginning. It will be months before it will all be here, but it is getting started and in record time. And this is the procedure that we have come up with great collaboration, communication, and cooperation. And Dr. Traxler will go into some more detail when I'm finished with this. But the first group, or what we call phase one or step one, the people to receive the vaccine will be those in the health care setting that are at the highest risk of contracting the virus and who are essential to preventing mortality. And those include such as physicians, physicians' assistants, nurses, nurses' aides, physical therapists, respiratory therapists, speech pathologists, medical students, and nursing students. It also includes nursing home and long-term care facility residents and staff. We know that over 40% of our fatalities are coming from the nursing homes, where people, of course, are in weakened conditions or they wouldn't be there to begin with. So the nursing home and long-term care facility residents and staff, medical personnel in correctional facilities, jails, and detention centers where close contact is, of course, quite necessary. Emergency medical and first responders like EMTs, paramedics, fire and law enforcement personnel, and home health and hospice workers. That will be the first group. And of the 200 to 300,000 doses that we are expecting, which will be the first of 2 doses that those people will receive, are not going to be enough to cover all of those people. But it is a start, and it will be productive. The next group is called Phase 1B. We just did 1A. This is 1B, or the second phase, will be people who provide services with a high risk of exposure due to interaction of the public. Examples include other first responders that don't have as much contact as those who have the hands-on contact with those that they are rescuing. That includes fire and law enforcement personnel, as well as workers in jobs that provide critical services like utilities, water, trash, transportation, and waste removal. Now, that is not firm, but that is the plan now. As we begin the first step and we see how that works out on the ground, then we will know better how to take the second step. But the second step also includes agribusiness and food production workers, people who live or work in congregate settings like group homes and homeless shelters, correctional facilities, jails and detention centers, people over 75 years old, and people with 2 or more of the following health conditions which weaken the body to fight the virus. These 2 or more of these are cancer, it's not in remission, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV, AIDS, obesity, pregnancy, and sickle cell disease. That is the second group. Again, that's not firm, but that is the plan. The third group of 4 is pharmacists and pharmacy technicians, grocery store, food service, and food delivery workers, service industry workers, postal workers, public transit workers, K-12 school teachers and school staff, child care workers and staff. I'm going slow so we can follow. School bus drivers, instructors and staff at higher education institutions, including 4-year colleges, technical colleges, of which, by the way, we have the finest in the nation, we understand and believe, and research universities, of which we have 3 magnificent ones, and they're here today. Persons aged 65 or older, and also people with one of the following health risk conditions as opposed to 2 that I recited a moment ago. And those include cancer, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV, AIDS, obesity, pregnancy, sickle cell disease, and asthma, cerebrovascular disease, cystic fibrosis, hypertension, immunocompromised liver disease, pulmonary fibrosis. The final phase is all the rest of us. And so that is our plan to date. And again, I want to thank the administration for the extraordinary work that you have done in working with the people of South Carolina to see that we tackle this virus. And
Governor, I want to commend you. Thank you for giving us a detailed walkthrough, and I look forward to hearing from more members of your team about the considerations that went into that. But Mr. Secretary, I think we've consulted with South Carolina all along the way, giving you our very best advice.
we appreciate
But
it.
I want to commend you for that. I also want to commend you for Operation Warp Speed has moved at a historic pace. And as the Secretary said, we expect to be able to vaccinate, pending approval this week, some 20 million Americans before the end of December, 50 million Americans before the end of January, and 100 million Americans. But I also want to echo your call for patience as we move forward. There will be every American will be anxious to consider this vaccine for themselves. We want people to have confidence in it, but even as we've moved at a record pace, I think I appreciate the fact that you have framed that we will continue to move at that pace, but for the average South Carolinian, this is a good time to recognize the focus and the priorities on those that are most at risk and those that are caring for those at risk, and we'll continue to scale that. And Mr. Secretary, the best estimate for the governor about when any American would have access to have a coronavirus vaccine if they chose to have it would be, we say the spring, others have said maybe by June, but you might favor them with a when do we get to that time when any South Carolinian that would want a vaccine would be able to have it in your best estimate?
So I would say first, listening to Governor McMaster's very thoughtful going through that distribution plan should reassure all South Carolinians and all Americans just how comprehensive this distribution planning has been with our nation's governors. If you need any better examples, right there. Secondly, we believe that we will have enough vaccine for any American who wishes to be vaccinated in the second quarter of next year. But that's not a moment in time. Literally every week, going right now, we get more and more vaccine from whether it's Pfizer or Moderna, and we hope eventually adding in companies like AstraZeneca, Johnson & Johnson, Novavax, Sanofi as part of our portfolio, producing 5, 10, possibly even 20 million doses a week progressively as we move forward. So what I've said is there could be, Mr. Vice President, starting in the month of February, depending on a governor's prioritization, more general access to vaccine in late February into March and certainly into April, quote, general vaccination programs. And as the governor set it up, programs that really will look more like your flu vaccination program. So it's just what you're used to, the type of mechanisms for distributing like the flu vaccine. We and he have tried to set this up to just be as an easy an experience for you as possible, especially after we get through some of these initial tranches of the most high-priority, vulnerable, and healthcare worker vaccinations.
Right. Thank you. Very thoughtful. I knew the Secretary would have the very best answer on that. So the second quarter and maybe April and May, where the average South Carolinian could enter the process and choose to have a coronavirus vaccine. So thank you, Mr. Secretary.
Well, I do have to say that all South Carolinians are above average. And also, before I ask...
and the most patriotic per square mile, right?
Per square inch.
Per square inch. That I wouldn't doubt either.
We're here in the presence of the University of South Carolina and Prisma Health, and I want to mention also, as I alluded to earlier, when the virus first came along in terms of understanding what to do and willingness to pitch in and to going into unknown territory, we did not require the hospitals to go to try to limit elective surgeries, although most surgeries are not procedures that are really not elective, but there's some that are more urgent than others. We didn't require it, but we asked them if they could do it. And every one of them did.
Right.
And we were in close contact, and when the pressure was off, of course, they went right back up. But that's just an example of the understanding and willingness to cooperate in a major cause that exists among the people
great example.
in our state.
It's a great example.
Lieutenant Governor Pamela Ebbett, the floor is yours now.
Thank you, Governor. It's an honor to be here today with Vice President Mike Pence, Governor Henry McMaster, Secretary Alex Azar, Congressman Timmons, and Congressman Jeff Duncan, and our COVID response team here in the state. 2020 has been one of the most challenging and difficult years in our country and in our state. I want to thank Governor McMaster for his stellar leadership. It has been an honor to work with him. I also want to thank President Trump, creation of Operation Warp Speed, which has been so wonderfully guided by our great Vice President. Our administration here in South Carolina has taken a measured and careful, targeted approach intended to protect our people while doing the minimum amount of damage to our economy. And now, new hope is on the horizon, thanks to the unprecedented efforts of our federal and state partnership to deliver a safe and effective vaccine. Thanks to the efforts of Operation Warp Speed and the countless hours of work by Vice President Pence and Secretary Azar's team, we will have vaccine doses in the state of South Carolina this month, and we are equipped and ready to distribute it. This is truly a remarkable and unprecedented effort that will move our country into the final stage of what will ultimately be the end of this terrible disease. Of course, I want to thank our always supportive and effective members of Congress. Team South Carolina is in full gear, and it has proven effective. 2 stars of that team are here today, Congressman Jeff Duncan and Congressman William Timmons. Thank you for your leadership. You provided federal assistance to combat and mitigate the spread of this virus to our state, while also providing the much-needed resources for citizens struggling during this unprecedented time. We recently completed the 2020 census in South Carolina, an effort that I was privileged to oversee. An important part of the outreach method and models used for the census completion will be similar to our distribution plan to educate and encourage the citizens to take the vaccine. We must recommit ourselves to protecting our population in much of the same way we conducted the census.